Okay, so this is the treatment activity that myself, Emily, and Hannah developed. The activity is a stuffed animal grooming station. A quick overview of the case study. Christina is a 2-year-old who has right spastic hemiplegic cerebral palsy. She has hypertonicity in her right upper and lower extremities. She does not like to be touched and avoids using her right side. She loves stuffed animals, music, dancing, and playing with her friends. Her 2 long-term goals include increased use of the right hand when playing with toys, measured by her ability to hold a large ball in both hands. And the second goal is to successfully rotate her body to both right and left sides 80% of the time while playing with a toy. She has both many strengths and limitations. Her strengths include successfully participating in playful activities with peers her age. She is able to stand independently and currently presents no cognitive developmental delays. However, her limitations include upper extremity right-sided spasticity, and while standing, Christina keeps her right toe internally rotated and lightly touching the ground, which affects her gait pattern. And finally, she does avoid weight bearing and being touched on the right side of the body. So the activity that we decided on, as mentioned earlier, is the stuffed animal grooming station. So how this activity would work is placing a basket on both the left and right side of Christina, who will be in an unsupported sitting position. Christina will be required to remove a stuffed animal from one basket, probably on her left side, hold it in her lap, and take a brush to groom the animal, and then place the groomed animal in the opposite basket on her right side. This activity does a great job of addressing both of the long-term goals. The handling and grooming of stuffed animals will help her to increase the use of using her right hand when playing with toys, and the placement of the baskets encourages her to rotate her trunk to the left and right sides. Hannah did a demonstration of this activity with her niece of how it would look if to be actually performed. So in the attachment with the brochure, you'll be able to watch that. Briefly going over handling and positioning techniques, the therapist will be seated in front of the patient, and the patient will be positioned between the 2 baskets in the unsupported seated position. This is a pretty hands-off activity for the therapist. However, he or she may place the stuffed animal or brush in the patient's right hand to encourage use of that extremity. Briefly going over the patient goals and how this treatment will help again, it'll increase weight bearing and tactile tolerance on the right side, use of both hands for play activities, specifically that right hand. The ability to move in and out of play positions may become easier, and it encourages trunk rotation. There are multiple performance skills addressed, all including motor, process, and social skills, as listed here. And the areas of occupations addressed is play, of course, and ADL, specifically grooming. And there are just a couple references listed right there. Like I said, I encourage you to watch the actual demonstration, and if you have any questions, please feel free to let us know. Thank you.